So I'm Matt Pagnotti, Director of Policy and Advocacy with AIDS Alabama, and welcome to Nothing About Us Without Us, HIV Advocacy 101 training. The history of HIV advocacy is one that is deeply rooted in community engagement and folks really organizing together to make change and institute changes to address specifically the HIV epidemic, but also working to address other issues impacting their lives and their communities and improve overall health and well-being for all people. And that's something that is still a really powerful value tenet of the work and the movement today, and is why we have a lot of the advances that we've had in recent decades around treatment and prevention, and understanding things such as U equals U, undetectable equals untransmittable, or the science that now says that if you are living with HIV and adhere to your treatment and have an undetectable level of virus in your body, you're incapable of transmitting HIV. So this training was one that we put together with our Positive Leadership Council to help train other people living with HIV and direct service providers and allies within the movement on how to be advocates for ending the HIV epidemic in Alabama and also across the country and the world. So a little bit about AIDS Alabama. We are a statewide AIDS service organization. We've been working for 36 years now to provide services, housing, social work and case management, transportation, prevention education, advocacy, navigation through healthcare enrollment, lots of other great wraparound services for folks who are living with HIV and their families, with a particular focus on folks who are low income, and working to address disparities within the epidemic and the communities that are impacted. And our Positive Leadership Council is a program that has been convened since 2012 now. It's an annual cohort of advocates who are living with HIV who receive training on advocacy and leadership skills and take on projects within their community to address key policies and issues that are impacting their neighbors. We have a Birmingham Animobile chapter, and together they work with us every year to coordinate HIV Awareness Day, which we'll talk a bit more about at the end of the training, and to help lead and advocate on issues impacting people living with HIV. So here's a bit more about the Positive Leadership Council. There are a lot of great, awesome topics that our PLC members can come and speak to you about. HIV prevention, peer-to-peer advocacy, working through issues around support or the journey of disclosure or non-disclosure and how to navigate that, and speaking at programs and projects. So there's a bit more about how to contact folks for that. So before we get too into the weeds yet with the training, I wanted to start us off with a quote to kind of inspire us and set the mood for HIV advocacy. It's from Frederick Douglass, who was of course a really famous abolitionist back before the Civil War, working to end slavery. The quote is, "Power concedes nothing without a demand. It never did and it never will." And I think the reason this is really powerful to remember is that the systems and general practices and policies in society that contribute to things like the HIV epidemic and to inequalities such as racism, sexism, homophobia, transphobia, classism, and so on and so forth they come from essentially the status quo and are at their root differences in power. So this quote really speaks to the fact that the way that those hierarchies are set up, the folks that are kind of traditionally at the top of that hierarchy are not going to just change things automatically, and it takes organizing as a community and finding the power that we all have as fellow community members and neighbors to make that change happen and tell them, well, we're going to really take that power and distribute it equitably, and that's how we're going to get the social change that we need. So it's important to situate ourselves when engaging in HIV advocacy in the local context. What does the HIV epidemic look like in Alabama and regionally in the South? And one thing that's really key to remember is that unlike the popular media conception of the HIV epidemic that focuses a lot on how the epidemic was in the beginning stages in the 80s and 90s, where it was very centered in large urban areas in the coastal Northeast or the West Coast, New York, San Francisco, some places like Miami along the coast in the Southeast. Today, the epidemic is very centered within the Southeast and much more rural than it was during the early days. And a lot of that is due to disparities in healthcare access among folks in rural communities, among communities of color, and lots of policies that contribute towards stigma around people living with HIV or folks in communities that are more impacted by the epidemic that are more prominent in states in the South. So up here on the slides, we have a couple heat maps that are color-coded based on levels and rates of people who are currently living in those counties, living with HIV in those counties. So it is a way to visualize what areas are more impacted by the epidemic versus others. And as you can see, there's some large swaths of really deep red across the Southeast. If you have the whole map, you would really see that the South in general is much darker shaded than the rest of the country, except for a few dots where there's New York or California or other places that you would more traditionally think of around the epidemic. And then this is a pullout of Alabama specifically. And one great use for this tool and it helps you to visualize where is the epidemic particularly located, and it really shows the stark disparities and who's being most impacted by the epidemic. So you can see here there's this swath of really dark shaded counties along what is commonly referred to in Alabama as the Black Belt. These are more rural counties, predominantly counties with Black residents, very much more agricultural based. So these counties are far higher impacted than you would normally expect for the epidemic. And then of course there's darker shadings around Jefferson County, where Birmingham is mostly situated, Mobile here in the Southeast, and some other kind of darker shading in and around those counties in the general area. And that really pulls out and shows the disparities between urban and rural areas and disparities in the epidemic around particularly communities of color, particularly LGBTQ folks of color that are being impacted by HIV. So building again from this resource, which is a great resource provided by AIDSView, by the way, AIDSVU. You can go to aidsview.org online to see all these maps. And they also have other breakdowns such as PrEP usage or maps around hepatitis. So I highly encourage folks to check that out afterwards if they can. So this is a specific dive into Birmingham as well. And once again, you can see some pretty stark disparities between these outer-lying, wider, more upper-class suburbs, and then the inner, more urban parts of the city in the center that are much more predominantly residents of color, particularly Black residents, that are being more impacted by the epidemic. So in general, like I said, the South is now the epicenter of the HIV epidemic in the country, and it is home to actually more than half of all people who are currently living with HIV and more than half of all new HIV diagnoses. So not only are more people in the region living with HIV than in other regions of the country, but there are also higher rates of transmissions and new cases. Alabama and other states in the Deep South are kind of extra disproportionately impacted than the overall region. Alabama currently has the 11th highest new HIV diagnosis rate. We're about 23rd or so on the rankings for overall state population, just to put that in perspective. And we actually have the 9th highest HIV-related death rate. So another phenomenon in the Southeast, because there's so many barriers to accessing healthcare, many people that are living with HIV do not get tested until they have kind of further progressed along with the toward later stages of AIDS, or they aren't able to stay into care or be maintained into care, and then they progress again further along into the stages of AIDS, and which is why you see in those states higher rates of HIV-related deaths. Again, as I said before, there's disproportionate impacts in the epidemic among communities of color due predominantly to racism within healthcare access and also other intersecting issues and barriers around accessing healthcare and healthcare quality. and the intersections between racism and discrimination based on race and HIV-related stigma. So in Alabama, over 2/3 of new transmissions of HIV, for example, occur among people of color. And for reference, that's much higher than the proportion in the overall population. We also see disparities around age, particularly among youth and young people, because there's such a lack of comprehensive education around HIV prevention or just sexual health in general. Many of our youth and young people don't have access to the tools needed or the information needed to keep themselves healthy and to prevent HIV. So we see currently more than a third of new transmissions of HIV in Alabama occur among those who are 13 to 24 years old. And many of these, in all of these categories, occur particularly among folks in those communities who are LGBTQ as well. Again, it's kind of these layers of barriers and layers of stigmas that are contributing to the epidemic in those communities. So one of our key areas for advocacy is around funding. If we don't have the funds to support the services for people with HIV, then you're going to see folks who aren't able to access healthcare or housing or prevention. So it's really critical that we make sure that these programs are being supported at the federal, state, and local levels. And it's also an area that's really close to our hearts as Southern advocates because, as I'll get to a little bit here later, there are lots of disparities in funding between the South and other regions of the country, even though, as we just talked about in depth, the South is more impacted by HIV than other regions. So probably the most famous and one of the most significant programs that are serving people with HIV is the Ryan White Care Act and the Ryan White HIV/AIDS program. Ryan White essentially is known as the payer of last resort. It's a federal program that provides support for services and HIV treatment for those who are living with HIV but can't afford their treatment outright. So it kind of works to be that, as I said, payer of last resort when folks may not have insurance or maybe underinsured, or they have expenses due to conditions and co-occurring conditions that are more expensive than their insurance is able to cover. So it's a federal program. It has a number of different components to it that get kind of complex, so we're not going to get too into that right now. But one of the most important components of Ryan White is the AIDS Drug Assistance Programs, or AIDAs. There's one for every state, and federal funds go to each state, mostly based upon need in that state around how impacted they are on the HIV epidemic. A little bit of it is based on population as well, and general kind of flat support. States are also able to contribute some money from their state budgets towards AIDAPs, and actually there's a matching component. So what that means is that the federal government will throw in some additional funds to match the level that states contribute. So we're actually really fortunate in Alabama that we have one of the highest state matches for the South, which, if you all know anything about Alabama budgets and how poor the state can be around services and programs, that's pretty amazing to be able to say that we're getting such a high match. And that's something that every year we advocate really heavily on. I'll talk a bit more about that later. Another really critical program is the Housing Opportunities for Persons with AIDS program, or HOPWA. And HOPWA is the only federal housing program that's specifically focused for serving people living with HIV or their families. So in many communities it provides support and housing programs. A number of programs in Alabama are funded through HOPWA. And we kind of have this slogan that housing is healthcare. So if you think about it, what are barriers for staying in care or treatment? Well, if you don't have a roof over your head, you're worried about where you're going to sleep the next night. It's really difficult in that situation to think about, all right, well, when am I going to take the medication? I got to make sure I can get a refill on time, go to my doctor, do my labs. Taking it if you have a medication that requires you to take it at the same time every day, or take it with food. All these things that are going to be lower level concerns if you're still worrying about making sure you have somewhere safe and affordable so that for you to live and sleep in at night. This graph here on the left breaks down buckets of funding for federal HIV focused programs. So you can see that the vast majority of it goes to care and treatment. Much of that is the Ryan White program. There's another chunk that's for global support and funds. So that's for a program called PEPFAR, which essentially is funding that US federal dollars go towards to support efforts to address HIV in other countries, particularly those that are most impacted by the epidemic but may not have enough resources in their nation to really address it as needed. Cash and housing assistance, so that's going to primarily be HAPWA. Research funds, the National Institutes of Health have quite a number of programs researching better treatments around HIV, better prevention measures, and potential vaccines or cures. So all of that is really exciting work going on there. And then the last sliver here is around prevention efforts. And as you notice, it's only 2% of the overall funds, so that's pretty low. And that's actually kind of not, we really should have more funding for all these programs. But that's something that when we go and talk to folks at the federal level, we would try to really stress that, hey, you should also be putting money into prevention because preventing new transmissions really is more cost effective in the long term because then, it's once someone is living with HIV, they need to go through care and housing and all those other supportive services, and those should definitely be there and be robust. But if government officials can also fund some really robust prevention services and programs, you're preventing new cases of HIV. Current cost estimates put it between $380,000 to $420,000 as the lifetime cost estimate of one case of HIV that's prevented. And that can also obviously increase in each individual case depending on other factors. Next slide. Oh, that's me. Oops. Healthcare access. So another key area for advocacy is around access to healthcare in general. Access to treatment for HIV, of course, is really important, but also we know that people living with HIV have other health concerns. They're more, they're whole people just like everyone else. So we need to make sure that they have access to all services for care, and for people who are HIV negative, that they have access to comprehensive prevention as well. So one of the biggest developments here recently was passage of the Affordable Care Act. Prior to the ACA being passed, insurance companies and the private market were able to institute a whole lot of different tactics and sneaky tricks to kind of keep people living with HIV or other expensive chronic conditions from being able to enroll on their plans and get coverage. And that was really just so that they could make sure they could not pay for those conditions and kind of make more profit as a company. The ACA changed all that. It removed the ability for insurance companies to have pre-existing condition bans, so they could say, if you have any pre-existing health condition, we will not give you coverage. Most folks have some kind of pre-existing condition. In many cases, insurance companies were even saying things like allergies or having been pregnant once before was a pre-existing condition. So that really opened up insurance markets for a lot of folks. Many companies also had things called lifetime coverage bans or coverage caps, where essentially they would say, we will cover all of your expenses up until a certain point for your entire lifetime. If you ever hit that cap, we will cover nothing else. That's obviously really problematic for people living with HIV or who have other conditions that are chronic and really expensive, because you're going to run into that cap much sooner, and then you're going to still need treatment. And there were a lot of other insurance barriers for people living with HIV. So passage of the ACA really was able to expand health insurance coverage for many folks impacted by the epidemic. Another key change from the ACA was that it allowed states to expand their Medicaid programs from, instead of covering kind of a slim portion of the population, to anyone who was making less than roughly the federal poverty level, 125%. So unfortunately, it was left to the states to decide whether or not to opt into Medicaid expansion. And Alabama, like many of our southern neighbors, has sadly refused to do so far. There's been research that shows that at least 200,000 Alabamians fall into what's called this Medicaid coverage gap, and that's depicted here on the right. So basically, the design of the ACA was that all states would expand Medicaid. So all folks who were covered under traditional Medicaid would have coverage, and then there would be coverage under expanded Medicaid, and then once, if they earned more than the amount that would qualify them for expanded Medicaid coverage, they would get subsidies to help them afford insurance plans on the private market. Well, unfortunately, in states that don't expand Medicaid, there's this gap now where some individuals make too much to qualify for the traditional Medicaid programs, and they don't make enough to qualify for subsidies to help them afford private insurance plans. So they're basically left without any insurance coverage options. That gap is really large in Alabama because we have one of the strictest income caps for our Medicaid program. In Alabama, if you earn more than 18% of the federal poverty level, then you are essentially too rich, quote unquote, for Medicaid in our state, and that puts you in this coverage gap. That's a pretty low amount. So you can see on this chart here, it was based kind of on averages for states, and it has about $4,000 a year for a family of four at 16% of the federal poverty level. So that's a rough equivalent of kind of where folks earn too much to qualify for Medicaid in our state. And as you can imagine, that's nowhere near enough to earn, to cover housing expenses, food, private insurance costs, all kinds of other things that you would need to survive. We've also been seeing an increase in federal and state attacks on healthcare coverage in recent years, particularly under the Trump administration. They've changed or attempted to change a number of rules around the ACA to try to allow insurance companies to provide less coverage, or even attempting with Congress a couple years ago to try to repeal the ACA in full. Thankfully, because of the work of a lot of advocates, including many who are living with HIV, that did not happen. The ACA is still the law of the land. But they're also working on ways to attack Medicaid, including traditional Medicaid. So one of those ways is by now allowing states to apply to add work requirements to Medicaid. So basically saying that if you want health insurance coverage, you're going to also need to be working or doing some kind of other employment activity they define. But the problem with that is that many of the folks covered under Medicaid either A, are already working part-time to the limit they can, or they have disabilities, or are caretakers for their family, and aren't able to really meet those requirements. And then, of course, also, you take away healthcare coverage for someone. It's really not it's really hard to keep a job if you aren't able to get care for the conditions that you, the care that you need and treatment that you need. And in states like Alabama, those policies almost create a catch-22, where if you work, suddenly earn too much to qualify for Medicaid, so then you're in this coverage gap and you don't have coverage. But if you don't work, then they'll kick you off because of the work requirements. So it really is kind of a no-win situation for anyone, and in many cases it's just kind of a way to lower the rolls on Medicaid and make it so they spend less as a state. Another really concerning issue that comes up a lot around HIV advocacy, and something that's really important for our work here in Alabama, is addressing HIV criminalisation. So currently 34 states, including our own, have laws that criminalize alleged HIV exposure or broader STI exposure, or enhance existing charges based upon one's HIV status. Many of these laws come from a wave of old policy that actually was part of the original passage of Ryan White, which created the Ryan White program, that said that states should have some kind of law around HIV exposure. And this was back in the 80s, when there was not a lot of understanding of current understanding around how HIV is transmitted. The treatment was still under development, so it wasn't like today where folks can take many of the modern treatments. You take a pill a day, and we know now that if you're engaged in treatment right away after you seroconvert, then you have essentially almost the same expected lifetime, almost the same life expectancy as a typical person who hasn't contracted HIV. So really, these laws were passed in many cases out of panic and out of fear and stigma around HIV, and not actual science or understanding of public health. There's also, so because of that, many of these laws, if you look at how they're written, don't contain language that takes into consideration risk of transmission. So in many of these cases, people who've been charged with these laws, if they spit at someone or they had consensual sex with someone else and both of them used condoms, or maybe folks didn't use condoms, but like I said earlier, if the person who's living with HIV was undetectable, then they can't transmit HIV that way anyway. So there's no conversation in many cases around risk of transmission, and often in a lot of these cases, there's also no conversation around intent. It's not in many cases required even for the person who's living with HIV to have intended to try to expose someone. And it's pretty much, in many cases, someone who's HIV negative but thought that they could potentially have contracted HIV or who contracted it later. It goes back to the law enforcement and really kind of becomes this mob mentality and stigmatization of someone who's living with HIV. We also know these laws don't help to address the epidemic in any way, and in many cases interfere with our efforts to address the epidemic. There's a lot of research that shows that they promote stigma around people living with HIV and actually discourage someone from wanting to get tested. If you don't know your status in many of these cases with these laws, then you kind of are shielded from them. Or they make it difficult for someone to stay in care or to want to stay in care. If nothing else, when you're engaged in the criminal legal system and you're incarcerated, that is on its own a big barrier to care. So these laws really not only don't reflect actual science or understanding around HIV, but are prohibitive for our efforts to try to end the epidemic. So in Alabama, we actually hadn't seen a lot of cases of HIV criminalization until very recently, but unfortunately there's been a pretty stark increase on that front. In 2018, there were several men who were living with HIV in the state who were charged under this new law called assault with bodily fluids. It was created by a legislator a couple years ago and went into effect last year. In both of these cases, the individuals charged either they spit at someone or come in contact with some other bodily fluid, in one case feces, that does not transmit HIV. So in none of these cases was there an actual risk of HIV exposure. And the way that the law is written, it has a felony boost for anyone based on whether they knowingly have a communicable disease. That's literally how vaguely the law is written. It doesn't have any language to say whether the bodily fluid that's part of the case is even a way you could transmit whatever infection is being talked about in that case. It doesn't have any language around whether there's intent to transmit or not. And like we said before, these laws really just create blockades to someone getting tested or staying into care. So that's something that we're following and really working to try to organize folks to address and hopefully repeal that criminal charge one day so that we can make sure we're really working to address the epidemic and not just criminalizing people based upon their health status. So it's really important to understand when working to advocate for policies and changes in law, how bills are made. Some of y'all may remember Schoolhouse Rock, which was an old cartoon series that came up with a lot of musicals that describe different things around math, science, history, etc. There was a really cute musical about how bills are made. So if you can't remember that, then no worries, because we have a whole lineup here. So the overall process for how bills are passed in Alabama, this is focused on our state level, but it's really similar to how it works in Congress. Legislation first has to be introduced. So you need either a state senator or a state representative, someone from either of the two bodies in our state legislature, to agree to introduce the legislation and sponsor it, or basically be the main author of that bill. They can either write that bill, or oftentimes, particularly in states like Alabama, advocates or lobbyists or other individuals with an interest will write the bill for them and say, hey, here's the model for this bill. Are you interested in leading that effort or not? Once that bill is introduced, it gets referred to one of several committees in either of those bodies, the Senate or the House of Representatives, based on the content of that bill. So, for example, many of the bills that we work on around HIV advocacy go to the health committees in either the Senate or the House because they're focused around healthcare access. But some of the bills are public safety is one of the committees. There's a committee around judicial matters, and a really important committee to remember, we'll get to here in a second, is the Rules Committee. So once it gets referred to a committee, that committee then can decide to put it on their roster to take up during one of their meetings. They discuss the bill and then they take a vote. Usually you need only a simple majority to pass a bill out of a committee. That's called a favorable vote. If they don't pass the bill out of the committee, then it's an unfavorable vote and essentially the bill is dead. Sometimes committees will also not take up a bill and will basically refuse to vote on it, which is another way of killing a bill. Now, in Alabama, you can request a public hearing on the bill, and if enough folks do that, then they kind of schedule that and get a room reserved for those meetings. You can also usually attend the committee meetings where they do vote on a bill, even if it's not a public hearing, and that way you can kind of see how the vote goes or what statements are made by legislators. And then lawmakers can also amend bills, and they can propose that during committee meetings or add it during any part of the committee process. So once a bill passes out of committee, it goes to the Rules Committee in either of the two legislative chambers. And the Rules Committee has a lot of power because they determine the schedule for bills that are voted on by the full state House or the full state Senate, which is the next step that's critical for passing a bill. Now, in Alabama, we have what's called regular order calendars, which is essentially the timeline of how bills were filed into the system. So it's kind of chronological, so it's similar to your Twitter timeline, essentially. There's also special order calendars, which is basically, these are the bills that we want to take up today, because we've decided as the legislator they're really important, and they kind of custom make it based on which bills they want to have up for a vote in that the next time that they convene. So that's more like Facebook, right, where it uses kind of what are things that we want to see, what are things that you want to see, versus which ones just got to us first versus last. So calendars are taken up every day that the session is convened and all the legislators on the floor, and the bills are then discussed and voted on, or sometimes they decide not to do a vote. They feel like they're not going to pass the bill or it's too controversial. But if it's voted on by the full state House or the full state Senate, then it's either passed or not passed. Again, if they don't pass it at this point, then the bill is dead. So if it passes that full floor vote, it then goes through the process all over again in the other body. So what happens sometimes is that the state House or the state Senate will pass different versions of the bill. Maybe there's an amendment that got brought on one side, or even sometimes there's like typos, or they decide to give something a fancy title, add a new clause, etc. When that happens, and if it passes through both the House and the Senate, then they need to come up with one unified version of the bill. And either this happens by a conference, where they send representatives from each of those bodies, usually some from both parties, to kind of work on a bill, a compromise version of the bill, or one of the legislative chambers can say, well, we don't want to waste time going to a conference, we'll just take up your version and pass it ourselves. And that way they have one version of the bill that goes then to the governor. And once it's at the governor's desk, the governor can either sign the bill or veto it. If it gets signed, it goes into law. If the governor vetoes it or refuses to sign, then the legislator has a certain amount of days that they can override the veto. That's really difficult to do because it takes a supermajority or 2/3 of both bodies of the legislature. So often that won't happen unless it's something that's really, really popular in the legislature that the governor decides to not sign. If they do override that veto, then the law gets passed anyway. If they don't, then the law is dead and you gotta try all over again. So that's kind of some general advocacy issues, and now we're going to talk about what our specific policy asks and priorities are going to be when we are engaging the legislator this year. before that funding is a really important issue. If you don't have money for programs, then you don't have programs. So there's always 2 specific acts that we bring up every time that go to the legislator. But basically each year when the legislator convenes in Alabama, one of their key tasks is to write up a budget for the whole state. Similar to how you should have a budget every year for your life, and you want to know, all right, well, I'm taking in this much money, and this is how much I'm spending, and you got to make them kind of work out. Then this is what the legislator does with the state budgets. In Alabama, we have 2 main budgets. There's one called the Education Trust Fund, which basically covers everything around public education and some higher education funding. Then there's the general fund budget, which is everything else. The problem that's been really ongoing in Alabama is that the Education Trust Fund is funded by certain taxes or other sources of revenue that increase over time. So the Education Trust Fund has been able to grow as Alabama's population has grown. The general fund, however, is funded by very flat taxes or flat revenues that don't increase over time, which means that as there's been more people and more services and programs that the Alabama government has wanted to take on or been required to do, the amount of money stayed the same, so we've been finding bigger and bigger holes in the budget each year, and that's really hard to maintain. So our 2 funding requests for 2019 are making sure that the Alabama legislature appropriates or requests and approves funding for the state AIDS drug assistance program match. I mentioned earlier we can put up a state match to then get more funds from the federal government, which helps us to have a better AIDA program and cover more treatment and services for people living with HIV. So we're asking for $2.5 million for the AIDS drug assistance program, and that's appropriated out of the general fund budget bucket, which, as I just mentioned, can sometimes be a problem because that's the budget that sees bigger and bigger holes every year. This funding request this year will be a continuation of the amount that they funded last year, and that's part of the reasoning for that ask this year is because there's a number of things such as changes to the Children's Health Insurance Program or CHIP that are going to require the legislature to put more funding into those programs, and we want to make sure that they at least do not cut the AIDA program, but probably it's not a great year to ask for increased funding at that level. But if they do get increased funds, then that's great. We are also asking for an increase in funding for the from the Education Trust Fund bucket to support HIV prevention education efforts. There's a line item in our Education Trust Fund budget that goes to these efforts, which is pretty unique for states in the South, so that's really exciting for us. And we're hoping that we can increase it by $70,000 up to $590,000 to make sure we can reach even more individuals and young people. Speaking of young people and prevention education, another big item that we'll have is introducing legislation to try to increase comprehensive sexual health education within Alabama. So currently in Alabama, public schools are not required to provide sexual health education, and there's no curriculum that's given to them if they do, except for a state law that provides a very slim guideline. And unfortunately, the language in this law is very outdated, it's very inaccurate. There's lots of mixed uses of HIV and AIDS, as if they're the same thing. We know that that's not true. And it's very stigmatizing, so it's extremely abstinence-only focused, which we know from studies for many years is not very effective. And it includes lots of language that's homophobic, such as, for example, it says that schools must emphasize that homosexual conduct is not an acceptable lifestyle, quote, and that it is unlawful. That's directly pulled from the statement in the law. So we're introducing a bill this year that will update that statute. It will strike out all of these homophobic and stigmatizing and inaccurate statements within the law. And it'll actually add language that will make it so that if schools opt into providing sexual health education, they need to make sure that the information provided is medically accurate, it's scientifically updated, and that it is culturally appropriate. So making sure that it is going to be really working to empower youth and young people instead of shaming them and making them feel bad for their choices. Instead, giving them the tools that they need to keep themselves healthy. key issue that's impacting Alabama right now is the opioid epidemic. You all probably have seen things like this on the news, as it's kind of impacting many states across the country, but in Alabama we've been seeing higher and higher rates of usage of opioids and injection drugs, such as injectable opioids or heroin, and partly along with that rise, it's fueled increases in new transmissions of viral hepatitis, specifically hepatitis C, and potentially transmissions of HIV, and most of that is due to needle sharing. So the dangers of that have been really illustrated by an incident that happened in Indiana several years ago, specifically in Scott County. Scott County is a rural county that's in the southern portion of Indiana, almost the border of Kentucky. It has a very low population, but a few years ago they saw a huge spike almost overnight in the cases of HIV and hepatitis. That was a result of kind of transmissions due to needle sharing between this cluster of folks in the community. They had been seeing this increase in injection drug use, but they didn't have services and programs around to engage that community. And so as a result, they saw a real overnight increase in transmissions. And in fact, the CDC afterwards did an analysis of all the counties in the entire country to kind of assess how likely it was that they would see something similar to that outbreak. And in Alabama, there are 4 counties in the Northwest, Marion, Winston, Walker, and Franklin, that were identified as at very high risk. They were within the 200 and so counties of all 3,800 counties in the country of seeing an outbreak such as Scott County. And in fact, Walker County is 37 highest. So it has the 37th highest risk of that outbreak of all counties in the entire country, which is really scary. And we've also been seeing in Alabama and across the nation as a whole very sharp increases in the rates of overdose deaths due to uses of substances, particularly heroin or opioids and other substance injection drug usage. And part of that is a result of fentanyl and increasing rates of fentanyl within some of these substances, which is extremely potent. So in many states and other countries in the world, they've found high success in using what's called syringe service programs to address some of these, to address HIV or hepatitis transmissions and overdose rates among people who inject drugs. In the past, they've been called needle exchanges, so syringe exchanges, but essentially they're programs where folks can go and safely dispose of any injection equipment, particularly syringes or needles that they use for injection. And they can also receive clean, unused needles or syringes. And while they're there, staff at these programs connect them to HIV or hepatitis testing, or to substance use treatment, to PrEP, for example, if they're HIV negative, to housing, mental health services, all kinds of other wraparound services that could be available. And these programs have been shown to be extremely effective at reducing transmission rates of HIV or hepatitis. And the reason for that is because if someone is currently using, maybe they're in the midst of addiction, then just telling them not to use or just don't share needles is not really going to work, right? They're still using at that point. So instead of just saying, hey, just don't do it, which we've really seen from evidence doesn't work, what these programs do is say, all right, well, if you are using, we want to make sure that you're keeping yourself as healthy as you can and that your risk of transmitting or contracting HIV is reduced. So instead of feeling that you have to share used syringes, we're going to provide you with unused syringes so that you can just use your own and you don't have to share with other folks. And that cuts down their rates of transmitting HIV. And then they also, as I mentioned before, give you a space to contact folks in these communities to help them connect with other services that may improve their overall health and well-being. And many times, because of that, you are then having folks get connected to things such as Narcan or naloxone, which is a drug that is highly effective at reversing opioid overdoses. So it is literally life-saving. Or when people are engaging in these programs, maybe after they come back a few times and they get to a space where they decide, well, I actually feel like I don't want to use anymore. do you have resources on substance use treatment programs I can connect with? So in many places that they've implemented these programs, some of them have been there for decades. They have seen that not only do they reduce HIV and hepatitis transmission rates and lower overdose deaths, but they actually increase engagement into substance use treatment programs. And very importantly, none of these programs increase rates of injection drug use in their community. People who are using are going to use anyway, whether or not there are syringe service programs. So that's a common misconception that we hear. And having these programs means that at least you're keeping people alive long enough to connect them with other health services and keeping them healthy. Many of the programs were first implemented actually as a community response by people who were using substances during the earlier days of actually the HIV epidemic, and during kind of an increase in heroin usage back in the late 80s and early 90s. So they were individuals who were seeing the impact of the epidemic, but because of the stigma around injection drug use and the fact that it was criminalized and still is often, government programs were unwilling to help them. And many other organizations were also kind of like, well, you're all on your own. So in fact, in many communities, particularly, for example, in California or up in the Northeast, folks who were using drugs said, well, we want to keep ourselves healthy. How can we do that? We want to make sure we're not at risk of contracting HIV, but we're not maybe at a space to stop using. And so they would actually kind of create these underground programs where they would help provide unused syringes to folks. They would help teach them about tactics for making sure that they're not getting abscesses, for example, or that they're, if they needed any services around substance use, if they said, hey, well, I know a good program you could go to if that's what you want. And then in the states that have had those programs for a long time, eventually they saw the science around it that showed that they were really effective and incorporated them into legal programs. And that's something that we're trying to work on in Alabama. So, on that note, we've been working for a number of years to introduce legislation that would authorize these programs in our state, so that our public health officials, community organizations, and people who are injecting and using drugs are able to have the tools they need to address the opioid epidemic and make sure that we're all keeping our community healthy. Unfortunately, the way the law stands in Alabama now, our drug paraphernalia law is so vague and broad and strict that if you were to try to operate a program like this, it would not really work because staff and participants would be at high risk of getting arrested and put through the criminal legal system. So many people would not want to engage in these programs at this point. So what we would do with this bill is make it so that the state health department or local health departments can work with community-based organizations to start up these programs if local government approves them in those areas. And these programs would be required to provide or refer participants out to wraparound services such as testing for HIV or viral hepatitis, mental health, substance use treatment, housing, naloxone access, and making sure that they're really working with folks to keep them healthy and prevent potential HIV or viral hepatitis outbreaks like we saw in Scott County, Indiana. So that's some of the things that we want to be pushing and advocating for at the legislator, but it's really important to meet and talk with your legislators to help make those things happen. It doesn't happen in a vacuum, right? If they have no one telling them why something's important, they're not going to pass it, or even vote on it sometimes. So when you're working to have a meeting with your legislator and your elected officials, it's important first to know what your meeting's going to be about. What are you asking them to do or not do? And what's your messaging, especially if you're here with a group of folks to do your meeting. You want to make sure you're all on the same talking points and the same messaging. Otherwise, your elected official or other decision maker you're meeting with could get confused. If you have one person that says, well, we want you to vote on this bill, and here's why, and someone else says, we want you to not vote on this bill in the same meeting, that's going to be really confusing, as you can imagine. It's also important to research your elected official ahead of time. If you do some Facebook stalking on a crush in the past. You want to use those skills, really. But in this case, it's to help make sure that you can find personal connections with that elected official. So if one of your group members went to the same school or college as that elected official, that's a great connection that you can use to kind of break the ice and help them feel more comfortable with you. Or maybe you both come from the same hometown. And those are things that you can bring up and help you to really build that relationship with this legislator and connect with them beyond just kind of, hey, we want you to do something for us. Next, you want to make sure you identify your goals. You want a specific outcome that you want that elected official to do and to take. It could be a bill that you want them to vote on, or a bill you want them to support or introduce. It could be a bill you want them to vote no on and to not pass. It even could be, hey, we just want you to be more aware around HIV and how it's impacting people in your district. So it doesn't have to always be exactly around legislation, but you do want something very specific that you have as an objective when you go in that meeting. These legislators have really busy schedules, so often you only get a few minutes to meet with them, and if you don't have a clear goal and kind of are meandering around in the conversation, you may not get much out of that meeting. If you have a group of folks, it's really helpful to decide group roles and kind of assign tasks based on individuals in the group, so that way you can make that meeting as effective and efficient as possible. So it could be good to decide who's going to initiate the conversation. This person usually also introduces everyone and themselves, so whoever that is should probably be someone who's familiar with who all is in the group. You also want to find someone who can take notes. That way you don't miss anything that can get said by the legislator or by other people in the group, and it helps you to review and debrief after the meeting, which I'll talk about later. If you have folks who are wanting to share their story or share an example of an impact, then it's important to note those as well and to make sure you leave time for that. And it can also be helpful to have a person whose responsibility is to make the ask or to ask the legislator to take the action that you want them to take or not take. And that makes sure that it doesn't get forgotten potentially in the conversation. And then another thing you could have is someone who will be responsible for wrapping up the meeting or coordinating the follow-up. And that makes sure that you can keep building that relationship with the legislator, and you can ensure that after the meeting you can follow up with them to know that they did the action you wanted them to do, or if they didn't, then you can kind of find out why, and maybe you follow up and pressure them and say, hey, we asked you to do this, you said you would, but you didn't follow through. And we find that really upsetting. So that's all the prep for the meeting. And now that you're ready and you're excited, you're here to go meet with your legislator, what do? So the first thing you want to do, right, is introduce yourself and your group members. Usually these elected officials don't know who you are. Maybe they do if you've met with them several times before, but you still kind of want to talk a bit, remind them, since they do meet a lot of people typically in their day-to-day interactions. If they're a federal elected official, like a Congress member, you're probably meeting with their staff versus the member themselves because they have so many meetings to do. And so then you may have to introduce yourself, even if you've met that elected official before, because the staff member may be new. They often kind of rotate every few years. When you're introducing people, it's important to make sure you identify who in that meeting are the constituents or residents of that member's district who are there at that meeting, or who has any relevant experience that's particularly important to note. So, for example, if you're having a meeting around addressing HIV, if someone's okay with disclosing that they're living with HIV, it could be important to have folks talk about why I'm a client of this program. Anyone who works at a HIV service organization, or if there are folks who live in the district and are voters in that district, to say, hey, I'm actually a voter of your district, I live there, addressing the HIV epidemic is really important to me. It's important also to note that obviously there's a lot of stigma still around HIV, and so if you're not comfortable disclosing, or anyone else in your group is uncomfortable disclosing, that's okay, you don't have to. You can speak from experience of more general experience around the impacts, or kind of talk about I'm an ally on this issue and really care because of these reasons, but you should not feel that you have to disclose anything that you're not comfortable with. And definitely, if you're in a meeting, don't out any other person's status without their explicit permission or approval. Like I said before, legislators have really packed schedules, so you want to make sure that you're concise. Keep your points really simple and to the point, and you want to make sure that you're staying on topic. Sometimes legislators are really bad at this and they get really distracted. Maybe you bring up like a favorite restaurant of theirs back home, and they go in this big monologue about this one time they went there and the food was amazing, but maybe the service was horrible or something. You want to try to rope that legislator back in so that you make sure you make the most of the time. And sometimes even this could be a tactic, right? If they're kind of uncomfortable with the topic and they're trying to get away and bring it back to something they want to talk about instead, you're going to need to make sure you say, hey, that's great, but we're actually here to talk about this issue, and here's why. Again, sharing personal connections to the issue can be impactful because it helps to present the human impact of that issue. Numbers are important, but we know that ultimately behind the numbers are human lives, and we want to make sure we emphasize what that impact looks like. So even if it's not personal to your specific circumstances, you could still share about impacts of programs or what it looks like to run those programs. Often legislators and elected officials are very unaware around the HIV epidemic, or especially what that epidemic looks like today, or what services and treatment look like today. So even just updating them on the basics around HIV can be really important and impactful, and kind of help open their eyes to why it's important to fund these programs. Definitely do not forget the ask. You're there to ask the elected official to do something, so you want to make sure that you include time to do that. Sometimes this can even just be finding out what their position is on a certain issue or legislation versus asking them to do something specific, especially if they're a new representative or state senator or senator, right? Because then you may not know a lot about where they stand on some issues, or maybe their position has changed. And then finally, when the meeting is over, you want to thank that legislator or staff member, if it's a staff person, for their time, and secure next steps for follow-up, like I mentioned before. Get really specific dates for, hey, when do you think you're going to vote on this bill? Or when will you, maybe if you asked their position before and they said, well, I don't know yet, I'm still reviewing facts, ask them for a date that they could get you their answer by. And that lets you have a deadline, so it makes it easier to hold them accountable to committing to that commitment. After the meeting, you're still not done, right? There are some steps to take on. Debriefing can be really important. There are lots of things that get brought up in meetings. It moves really fast, so you want to make sure you summarize the whole interaction and note some highlights like, oh, this was really important that they said that, or hey, I remember they committed to doing this. But make sure you do this in a safe space, right? Don't do it in their office or right outside their office, because you never know who's listening. Or sometimes they have friends that walk down their hallways and go to their office, and if you're trying to debrief about something tactical and someone overhears it and brings it in their office, then that could ruin your whole strategy. So wait till you're in a safe space among friends. It can be really helpful to follow up with a thank you note. That lets the legislator or an elected official or their staff member know you were appreciative of their time, and it helps to remind them of the meeting because they see that note or email and they say, oh, I remember we met with that person. Oh yeah, they talked about their program and how they do this really awesome thing around peer support, and I had never thought of that before, and we want to make sure that we learn more about that. That's cool. Sometimes they'll ask you to provide requested information or materials. So if that's the case, you want to make sure you provide all that in a really timely manner. This can be true, for example, if an elected official says, oh, actually we have a grant coming out and we would love to know more about your program to help you with the seeing if that grant's right for you, or if they ask you for information on a specific issue that you want them to support, then you can send them fact sheets and things like that. And again, you really want to hold the elected official accountable to any committed action items or deadlines that they gave you. So that's really important. And that lets them know that people are following them, and that they're going to remember those actions next time that people are voting. So that's why it's so key, because then the next election rolls around, you can say, hey, we remember we went and met with you 3 different times on this issue, got 3 different answers, and this legislator never met their commitment. So if they know that you're watching and you're taking notes and records of that, it helps to give your group more power, because then they're going to recognize that you have a lot of influence over that and over whether they get another term. Some other tips and tricks to remember: read, relate, relax. So read the room, read the legislator, identify things that you can relate on, or things to break the ice, make the conversation more comfortable. Oftentimes in offices we'll have pictures up or posters of things that they may be interested in or people they've met. Those can be tips for things you can bring into the conversation. Relate to the legislator, relate to the staff member, relate to other people in your group, maybe if you've not met them before. And relax. Even though this is a very goal-oriented conversation, and you have direct objectives you want to get out of it, it helps to make sure you remember that it's still a conversation, right? You kind of want to keep it friendly and approachable as much as possible, because that way you get that staff member or legislator to lower their guard, and they can be more frank and honest with you, and you can maybe make a really deep connection with them and help to sway them on the issue. Something to watch out for are filler words. Those are things like ums or uhs in place of when you're thinking of the next word to say. And they can make what you're saying a little less strong. So strong language is also really helpful. An example of that is saying that this bill will improve health outcomes versus this bill could improve health outcomes for youth. So that strong language just helps to make it sound more concrete. If you say there's could, then there's a chance that it may not. So you want to be really definitive with the things that you're saying and the facts that you're providing. It's okay if you don't know the answer. Sometimes you'll get asked questions by legislators or staff members. It may be something you don't know. It may be something really specific and nuanced, or it could be something that no one knows the answer to yet. And if that's the case, just acknowledge that. You could always say, hey, I don't know the answer, I'm sorry, but I'm happy to look that up and follow back up with you to give that answer. But never in any case make up an answer. Don't pull something out of your butt, because it could be untrue, and especially if it's not true, even if maybe you think that it's true, but you're only half remembering. If they follow up and look up that fact later and find out that's not true, then that could really hurt your standing with that elected official. Stay on message. Make sure, again, you have only a few minutes to have this meeting and to get your point across, so you want to keep onto your messaging. And sometimes there are specific points that are more helpful than others to swaying legislators or elected officials, so you really want to focus on those and to make sure that your whole group is speaking with the same, staying on the same message, providing the same front. And again, set deadlines for a response. So if legislators are going to get back to you, get a deadline for when. Ask them how they'll get back to you. So now that we've talked a lot about how to meet with your legislator, let's role play. So we're going to have a few folks, trainers here, give some brief example of this, and then we'll have you all pair off to do it on your own. But one of us here and one of you all in your groups will pretend to be a legislator, and the other will be a visiting advocate for the meeting. So you're going to come up with an issue that you're wanting to meet that legislator on, and then you're going to ask for you to give that legislator. And then when you're done with that meeting, we're going to have you switch roles, and then depending on time, we'll have folks switch off with new pairs. But first we're going to have a pair up here go and give an example. Awesome. So now that we've talked about some key issues to advocate on, funding, addressing HIV criminalization, expanding healthcare access and Medicaid, we practice meeting with your legislators to sway them on the issues and get them to make the changes you want. What are some other ways to advocate right now? What are some ways to get involved? Well, like you asked, Here in just a few short weeks and days, we have our annual Alabama HIV Awareness Day. We've been organizing this event with folks all across the state for over 20 years now, and it is an exciting gathering of people living with HIV, staff from AIDS service organizations, healthcare providers, and other community members who are interested in addressing the HIV epidemic from all across the state, where we meet in the capital, Montgomery, and we hear from a lineup of speakers and advocates on why advocacy is important, what are some ways they can advocate, what are some important issues to advocate on. We have a banquet lunch that's provided, and then all of our usually 300 or so attendees will gather for a march through the streets of downtown Montgomery to the State House, where we will then meet with our elected officials and talk about some of the issues that we just brought up here earlier in the presentation. And this day not only helps inspire us as a community and empower folks, but also raise awareness around HIV and let our leaders in our state know that we are here, we're not going away, and it's important that they address the epidemic and end the epidemic in Alabama. And we're going to give them some examples of how they can do that. So March 14th is when we're going to be holding our Awareness Day this year. It's going to be initially at the Doubletree Hotel in downtown Montgomery. There's the address up there. Doors will open at 10 a.m. at the hotel. The event will officially start at 10:30 with our lineup of speakers. And then the afternoon, like I said, we'll march through downtown to the State House. Here's some pictures from previous years of Awareness Day. We're going to have a resource for organizations and groups of folks to pre-register ahead of time with us to let folks know how many people in your group are coming, just so we can kind of get a general head count for materials. More details will be out about that. If you're in the Birmingham area, then you can contact Action at AIDS Alabama, AIDA, so then Alabama all spelled out, .org to coordinate transportation. And then if you're outside the Birmingham area, you can also email and contact us that way. And that way we can help coordinate transportation with organizations on the ground. And when we're in the State House, we will have meetings with legislators. There will be State House guides from your area who will help you to find out who your legislator is and kind of help assist you in your meetings and navigating the State House, because it can be a bit of a maze sometimes. So we'll have handouts at Awareness Day that will share what some of our specific asks for the legislators are. Most of them will be the ones that we just saw previously. And there'll also be some materials to hand out to legislators as well. And lastly, before we end here, we have some resources to share with folks. So there's some flyers on Awareness Day that give more information about everything we just talked about. We have a manual here on advocacy for 2019. So it talks about a lot of what we just went over in this training and some other tactics for advocacy, how to write letters to your legislator, how to put on a media event, how to create a coalition, and goes way more in depth than we can do in the time we have here. So definitely check that out. We also have handouts on meaningful involvement of people living with HIV. So the principle that nothing about us without us, that comes from the very beginning days of HIV advocacy, and why it's so important to center people living with HIV and the leadership of people living with HIV within this movement. And that comes out of the Denver Principles, a copy of which is also provided, which is basically the founding document of HIV advocacy. It lists a number of principles and values for how to do this work in a way that meaningfully engages and involves people living with HIV and centers them as people first, right? That they are holistic humans and people with full lives, and we want to make sure that we're engaging them as people, not just as someone living with HIV and just as the virus. So that's why we say things, right? Like people living with HIV, people first language versus someone who's HIV positive, which is kind of emphasizing the virus and not that person as a person. So thank you all for attending this training and for taking these steps to being an HIV advocate and wanting to get involved and make a difference. Like I said before, meaningful social change happens from us working together as a community, It comes from community members organizing and mobilizing and holding our leaders accountable to making that change and saying, this is how we make a better world, do this, because in a democracy like we have here, people are the ones in the power, right? Sometimes our leaders forget that, and all of us working together are going to remind them of that. Really hope that you all can join us for Awareness Day this year or for other advocacy events. There'll be some more materials and resources here, or you can always contact us later to learn other ways you can get involved and to continue to grow as advocates and leaders, helping us to end the HIV epidemic in Alabama.